Today we're going to talk a little bit about that holy grail of plastic surgery, or non-surgical body contouring. Patients are coming in asking for this. There's a lot in the media about these magic salves and potions and wraps that actually shape the body without surgery. Brian, do any of these things work?
Well, it depends on actually what we're trying to accomplish, right? And how much result the patients are really going to need to see improvement and to be happy. The vast majority of my patients, and I think we can look at some of the research and some of the consumer-oriented websites and look and see what their satisfaction rate is with a lot of these non-surgical things, and it's actually pretty low in most situations. I will say the one exception to my practice has been Selfina. My experience with Selfina, which is basically a subcision technique which releases the dimpling.
And what does Selfina treat?
Basically, that typical hail damage type of cellulite. It works very well for. All the studies that we have now are showing a permanent improvement, at least out to the 3-year mark.
Brooke, what do you think about these non-surgical fat removal devices?
There's a couple questions. One, how effective are they? How much fat can you remove? And I think for small areas, not excessive fat, they can be helpful. Are they perfect? No. Are they ever going to replace liposuction? No. But for some patients who don't want a lot of fat removed, I think they can be helpful.
Do you think that there's a place in the future for these injectable mesotherapy things like Kybella, for instance?
It's been tried for years and years, and the real scientific studies are not that supportive.
There's some new devices out there on the market that are radio frequency, microwaves, that you put underneath the skin, on top of the skin, different direction. Have you had any experience, or what do you think about those?
Same sort of thing. I think they're trying to stimulate tightening of the skin from a potentially safer location, and maybe perhaps be able to mitigate some of these issues with pain and things like that. But I think still we're asking too much of the skin in many of these situations, and we just aren't going to be able to quite achieve.
So we don't yet have these magic things to either easily get rid of fat, but more importantly, to tighten skin. And those are the holy grail of what we're after. So check out theplasticsurgerychannel.com, and thank you to my guests, Dr. Brzezowski and Dr. Sepper.